for the second half of the morning, is that better? Sorry about that, okay. We're going to be talking about two subjects. We're going to be talking about ICD-10, everybody's favorite subject, and we're going to finish up with a review of Provider Source, the credentialing application. And we have an overview. We have some sort of hands-on experience from a provider organization in ICD-10. We have another panel presentation, and then we will have sort of a combination of Q&A and a little bit of a update from Teresa on Provider Source. So that's what's ahead. Before we dive into the ICD-10, I've been asked to perform a brief survey. So we'd like to do this with a show of hands. So since we're talking about ICD-10 implementation, I'd like to get a sense, how many of you have not yet started down the path of ICD-10 implementation? So, okay. And how many of you have recently started down the path of ICD-10 implementation? Okay. And how many of you are well along the way? Okay, we've got, for those who answered, maybe a third is kind of my sense. All right, second, and you have to be honest on this one. So I'm going to ask you what your confidence level is, being ready for ICD-10 1 year from today, October 2014. So the first category is don't know how confident you are. Okay? The second is pretty confident. Okay? How about we'll absolutely be there by then? Okay? How about I'm going to take my discretion to add a fourth? How about I see no chance I'm going to make it? Okay, that's that truth comes out there, right? Right? Okay, well, thank you for that feedback. And we are going to provide an overview. And again, I mentioned this morning that we're very fortunate to have folks from health plans, provider organizations, and State Hospital and State Medical Association. And for the ICD-10 overview, I'm very pleased to introduce Michelle Lott from the Washington State Medical Association. And we really appreciate her willingness to come share her expertise on this issue. So please join me in welcoming Michelle.
I think there should be another question. How many of you have never heard of ICD-10? Because I get calls. They do come into my office. So I'm going to talk about ICD-10, and I think the most important question and the number one question we get at the Washington State Medical Association is, when is it going to be delayed and when is it going to go away? So just for your information, as far as we know, CMS is marching forward with the October 1, 2014 date. There was a House bill that was dropped called Cutting Cost Codes Act of 2013 to stop and completely get rid of ICD-10 implementation. However, hasn't made it out of committee. And with the recent governmental shutdown, the likelihood of it making it out of committee, well, I'll let you guess on that one. So moving forward with ICD-10 is the only way you're going to be able to secure your financial and compliance requirements for Medicare program and other payers. So let's talk about the most important stuff. When do I have to do it? What is it going to mean? As many of you know, ICD-9 has not been being updated the last few years. October 1, ICD-10 will go into effect, but believe it or not, there haven't been major updates to that code set in the last 2 or 3 years as well, because there was a code freeze. So October 1, 2014, you get to implement it, and a year later, they're going to make a major change to it. So get ready. But it's something that you got to think about as you're preparing now, just preparing for that major change in a year after implementation. So as many of you have probably seen these slides 1,000 places, ICD-10 and ICD-9 have some significant differences. I like to say that looking at ICD-10 in the code book is like learning a foreign language if you've never learned one before. It's kind of scary when you first open that book and you see those very long codes with the letters and the numbers and they're all over the place and you're like, oh, where am I going to put them all? But believe it or not, there are some fundamental similarities. And there's some benefits. ICD-10 offers some greater specificity. So from a clinical perspective, that's going to be a very good thing for our providers, even though they don't think so now. There's going to be some combination codes. Before, when you had to report that a patient had diabetes and chronic kidney disease, you used two codes. Now you'll be able to use one code, so it'll help simplify some things. There are some expansions so that we can create and gather more clinical data. And there's also some changes in how they do combinations of conditions and manifestations. Anybody who's been doing ICD-10 has seen these slides 1,000 times for the last few years, so I'm not going to go into great detail on them, but there are some similarities. Believe it or not, the most important thing you need to know about ICD-10 is always look at the 3-digit category. Anybody who's ever learned coding and learned diagnostic coding was always told to go back to that 3-digit category in your ICD-9 book. It's the same thing. It's the same concept. So how we use our ICD-9 and ICD-10 books, believe it or not, even though they look totally different and weird, they're going to be used pretty much in the same similar ways, the code books. There's a decimal point after that 3-digit category, and that's pretty much where the similarities end. But it's not that big of a change if you start looking at it. The biggest changes are really around the documentation, and we'll be talking about that as part of the case study. So other benefits of ICD-10, and this is the one where it can be both a blessing and a curse. So one of the benefits is that it will help improve the quality, safety, and efficacy of our healthcare system. It'll allow us to gather more data. Data analytics is going to be a big part of your practice as you move forward with the ACA, with ICD-10, meaningful use, pay for performance, all of those criteria that you need to be doing today. These codes are going to help facilitate that. And it's going to also allow you to monitor resources and conduct research. And it's going to help you be able to track patients with certain diseases and conditions in ways that we have never been able to do with ICD-9 because it has been so limited. I can always talk to coders, and they always come to me and say, my doctor asked me to find a diagnosis code in the ICD-9 book, and it doesn't exist. Well, guess what? You're not going to have that problem now. You're going to be able to find that code and probably 30 additional ones on top of it. So it'll be a question of narrowing it down. But it's not going to be a horrible, horrible process. I think we're more scared of change than of the codes. So one of the things that you have to do that is going to impact you, as many of you have not, probably realized as you're getting ready and have started down that path, is that you're going to have more detailed documentation. You're going to have to it's going to take longer to translate codes. There could be delays in payments and claims, and so you need to prepare for that possibility. It's like Y2K. We got all ready, and it fizzled. We hope that we get really ready and nothing bad happens. That's the plan. So you're going to need more time. A couple of things to keep in mind about ICD-10. Like I said, they're not that different from I-9. They're a little different, but reality is that the changes are things like laterality. You have a left hand, you have a right hand, and before you would only have one code and it wouldn't distinguish. Now you have a code that'll say, yep, it was the left hand, yep, it was the right hand, it was both hands, oh, we don't know which hand. So what was one code is now 4. So 36% of all the ICD-10 codes that have changed just because of that laterality. So when you think of it in that terms of what the similarities are, it's not that big of a deal. One code became 4 because of laterality. 9 times out of 10, your documentation is going to have that information. And if it doesn't, it should, because it's good clinical information to be putting in your chart notes. The other thing to keep in mind is you're going to have to run dual systems. You're going to have to be able to go back and look at your ICD-9 codes from what you did in September and August. If you do any kind of clinical studies and you're doing them over a long period of time, you're going to need to go back. Guess what? Audits. How far back does Medicare audit when they do audits, or your private insurers? Those are things that you're going to have to run. And so you're going to need to be able to track all of that. And this is going to have an impact on your practices. But if you start thinking about these things now, you can help mitigate those impacts. Also, the biggest impact that we see at the Medical Association is coding and training. I know a lot of physicians are like, I don't need to go to training. Well, yes, you do. It's a new diagnostic code system. It's not like our yearly code updates where a few hundred codes change. This is thousands of codes that have changed. Their structure is different. The terminology is different depending upon your location. So you're going to need to train. And not everybody learns at the same pace or the same way or the same style. I like to get it, sit on it, stew with it a little bit, think about it, and then learn it. That's how I operate. Some people, they just get it really quick. It depends upon your level of experience. So depending upon your size, if you have, let's pick on the Everett Clinic, and you have hundreds of doctors and hundreds of coders and nurses and RNs and RARNPs, guess what? They all got to get trained. So who's going to do that training? So really it's going to be based on a lot of different things for your practice. So one of the things that you'll get when you download the slides from the One HealthPort website is we put a couple of resources in here. And this is something that you can think of it. We like to call it our ICD-10 12-step program. It is actually based on the AMA's implementation plan, and it breaks down ICD-10 into 12 steps. So if you haven't gotten started or you're just in that beginning phase and you're a small to medium-sized provider, then this might be a nice 12-step program that you can implement within your practice to help you at least hit the high points of your implementation. Things like budgeting for implementation costs or doing testing. Contacting your trading partners. You'd be surprised. If you have an EMR, your EMR is going to help you. Your clearinghouses are going to help you. What I don't want you to think about is that your clearinghouse or your EMR is going to be the only thing you need to do. They can't assign codes. Only the provider can assign the code. You still have to do something. There cannot be your one-stop fix for ICD-10. And believe it or not, once you implement ICD-10, you're going to have to do more staff training. This is not going away. You're going to have to monitor your claims. You're going to have to, after your implementation, you're going to have to monitor the use. And there's going to be changes and information that comes out about documentation and improvements that you'll need to make along the way. There's also a lot of resources out there for practices. If you Googled ICD-10, you might be there for weeks going through all the various resources that could come up for you. And believe it or not, they've got some great information that can help you implement this, especially if you're a small to medium-sized practice and don't have a lot of resources to help you through this. And so I'm going to just mention some of these. CMS, believe it or not, has been working very diligently to push out educational training material. They've been working with Medscape to produce free continuing education resources to educate providers and their staff. They have a roadmap as well as a clinical practice guide to a smooth transition for ICD-10. And those are available on their Medscape website, and it doesn't cost you a thing. You just got to register, and it's free. We like free at the Medical Association. We believe in free resources. There's a lot of stuff on ICD-10 that you can find on the CMS website for small and rural practices. One of the things to keep in mind, there's going to be a lot of changes to the LCDs and the NCDs, and so those are going to be posted. So if you have not gone out to the ICD-10 website at CMS, highly recommend that you do. Those LCDs and NCDs help determine medical necessity, and those are the documentation pointers, tips, and tricks that will help you sell that information to your providers. Also, the WSMA works with the AMA on a lot of things. They have a project plan, they have implementation tools, checklists. Many of you may be coders and are members of the AAPC or AHIMA, which are the two coding organizations. They have a plethora of resources available, both free and for purchase, as with anything else. And then for the WSMA, We offer a lot of things through our organization, and one of the things that we are doing, it is a paid service, is documentation review. If you're just lost and you don't know how to do one of those, we can help you figure out how to do the documentation review and review some of your documentation and give you points and tips and tricks on documentation for ICD-10. And we'll be doing a lot of coding and educational programs, and we're going to be putting out a lot of free resources on our website. So if you haven't ever been to the Washington State Medical Association's Practice Resource Center, I recommend that you do that. One of the things that we do is if you're a member, which a lot of people who participate in One Healthport are, you can call us and we answer questions. And just because I, like punishment, I've included my name, my number, my email address, and I am happy to answer any questions that you have on ICD-10. It is something that I do quite a bit of at the Medical Association. I see many faces out in the crowd that have been to programs that we have done. So hopefully you can contact me, and I can take a question or two.
Yeah, I think we have time for maybe one question, quick question. Any questions?
None? Really? No. Way in the back. This gentleman way in the back.
Okay.
So do I. I appreciate that in people.
How do you propose, say, like what I call this number, because I need assistance in educating a very senior orthopedic surgeon on appropriate documentation for ICD-10?
I would say that you could call me.
Could you just repeat the question, Michelle?
Oh, okay. So he wants to know where would I go to get resources to help educate a very senior orthopedic physician in the documentation requirements. So my first thing I would say is to anybody in the orthopedics specialty, I'm sorry. It's my standard disclaimer. I actually work very well with a lot of orthopedic physicians and do have a lot of resources on orthopedic coding and requirements for the documentation regarding ICD-10. I also work with another consultant who is a former orthopedic specialist and MD who does a lot of information and has several free resources available on his website. If you would like to contact me, I'd be happy to share that information.
Michelle, really, thank you very much.
You're welcome.
That was a wealth of information. And since you were nice enough to offer it, I'm going to leave that up for just another second while I talk before I introduce. Okay, she's offering herself for help. Take advantage of it. Again, thanks very, very much. So in putting this together, putting this program together and working off this theme of colleagues. Oh. Does that mean I win a prize, Bill? Okay. Oh, all right. There you go. Yeah, that's right. Sorry, you're done. That's it. In putting this program together and working off this theme of colleagues talking to colleagues, one of the things that we've heard from audiences we've talked to in the past is case studies are particularly appreciated. Somebody who walks where you walk and lives in the world you live in and has maybe a couple of steps ahead and has gone through some of the difficulty of trying to implement some of the changes. And so we feel very fortunate in that Family Care Network and Karen Warfer have generously volunteered to share her experience with you walking through this process. And Karen tells me that she believes her presentation will conclude in time to take some questions, but we'd like you to hold the questions until she finishes, and then we'll go from there.